November is also called Movember, sometimes even referred to as No Shave November. It's an international movement to raise awareness for men's health issues, particularly prostate cancer. And while many people think about prostate screenings, men are at risk for a variety of conditions. So joining me now is Dr. Amberly Wolber from Mayo Clinic. She's talking to me about the most common things that affect men through the year. So good morning. Thank you so much for joining us.
Good morning. Thank you so much for having me.
Absolutely. So I'm curious to know, what's the biggest misconception about men's health?
Well, there's a lot of things that you could dive into in regards to that. I would say some of the biggest ones as far as misconception is that you really only need to be worried about your health when you reach the latter portion of your lifespan, so maybe 50 plus. And that just really isn't the case. I do feel like things have changed quite a bit there with the change in how physicians and patients interact now. It's not so much the doctor tells you what to do and then you do it. It's a joint discussion, and that's even more applicable for our younger men, younger than 50.
And what advice do you have for men in, let's say, their early 20s or 30s? Do they need to see a urologist?
Well, not necessarily a urologist, but I would definitely establish healthcare with a primary care provider. It's never a bad idea. But the big ones to kind of watch into, and I would tie it into, especially following the month of October, monthly exams of the testicles, just like we talk to our ladies about doing monthly exams of the breasts. Good time to do it would be in the shower. You're in there anyways. You're basically feeling for any lumps or abnormalities, hard spots within the testicles themselves. Testicular cancer does tend to hit 20-year-olds, 30-year-olds. That's the prime time when we're typically talking about it. So that's a good one. Another one to pay attention to is urinary symptoms, urgency, frequency, anything along those lines, maybe some blood in your urine. Obviously, those are reasons to see a urologist. But even just to establish a primary care physician to start things early, should there be an issue.
And as men get into their 30s and 40s and expect to expand, their family, should they start trying to incorporate healthier lifestyle changes, or should these really start as soon as as early in your teens or 20s?
Well, let's be honest, no offense to the guys. That's why I was kind of giggling about me doing this. I'm the only female in my department, and I'm here doing the Movember section. But, I think with guys, being on top of things, particularly something like their health, is not in their first thought. That's why I would really focus on, for our younger folks, doing the testicular exams, monthly exams along those lines. Other things to pay attention to, as you were alluding to, with starting families. If you are thinking about reproducing, having children, paying attention to your diet, avoiding things like hot tubs, other things along those lines, those are things that you can have a conversation with the urologist about. I would say that if you've got about a month or so, about 6 months, and you've done it, as recommended, and you're still having trouble conceiving, that would be a good reason to come in and see a urologist or your primary care physician to get that started. In regards to other things, such as erectile dysfunction, sometimes those things get overlooked. But the big thing that I would say in regards to that is there have been more and more studies that have alluded to, typically if you start having some erectile dysfunction, it's oftentimes revolving around microvascular issues. And so if you're getting clots, for example, in the tiny vessels that are responsible for erectile function, they're probably affecting other areas. And that could be, heart, could be cerebrovascular brain, other things. If it's occurring there, it's likely occurring elsewhere. And those are good reasons to go ahead and start paying attention to, do I need to get something further evaluated?
Wow, there was so much information that I feel like I've never even thought to even think about, that I feel like I need to go and tell my fiance and my dad and my cousins, because there's just so much that we don't know about. So I know the information that you just told us is going to help so many people this morning. So thank you again for joining us.
You're very welcome.